Qualified, professional, and compassionate doctors talking real solutions to real health problems.
This message is from the Ministry of Health with support from partners.
Good evening, ladies and gentlemen, esteemed viewers and fellow healthcare enthusiasts. We welcome you to yet another highly informative edition of the DOCtalk Show, brought to you by Quiz Mali Productions and proudly sponsored by the Ministry of Health of Uganda and its partners. I am Dr. Muyanga and your host tonight on the journey into the world of medicine. And tonight we are exploring an important topic, that is cancer of the esophagus. Tonight in the house we have a special guest, that is a senior consultant surgeon from Mulago National Referral Hospital, Dr. Kabweru Wilberforce. You are welcome to the DOCtalk Show.
Thank you very much, Dr. Muyanga and all the viewers. My name is Dr. Kabweru Wilberforce and I work in Mulago National Referral Hospital. I'm a senior consultant surgeon, and the topic today is one of the biggest conditions that actually we see with so many patients that come to Mulago. So today we shall be discussing cancer of the esophagus. When someone hears the semantics of esophagus, they may think they're on the moon. The truth is, the esophagus is that place between the mouth that takes food to the stomach, and in other books is called the gullet.
The gullet. Dr. Kabweru,
yes.
Let us slow down a bit.
So it is that tube there.
So the tube.
That when you swallow food in the mouth, the one that takes that food slowly into the stomach.
To the stomach.
That is the esophagus.
Okay.
Yes. It exists in children and adults.
So it's past the mouth, but before the stomach, that tube.
That tube.
Okay.
So that cancer we are discussing is that cancer that affects that place. So how does someone know that actually has cancer of the esophagus? So if we could say, what is this cancer? They think that this cancer used to be very common in adults that were above 50 years. But of late, actually, we have realized that actually we see so many younger people in the 40s, 30s, as early as 17 years. And it is quite now terrifying. And there is no risk factor in these patients, that you don't find any other disease sometimes. Some you find the other diseases, but some actually you find that actually they have only this disease and they are very young. So that has changed the tables around from the other early narrative that is among the elderly. No, now it happens across all age groups.
So to our viewer out there who planned to tune out since the discussion is about cancer, this is a wake-up call that cancer of the esophagus is no longer something that happens in the elderly or those above 50. But as Dr. Kabweru has said, he has seen young people as young as 17 years presenting with cancer of the esophagus. I have seen young people as early as 17 years presenting with this. And so if you are out there with a relative or you yourself suspecting that you may be having this issue, kindly stay tuned in. We have our Twitter page for the DOCtalk Show. We also have a YouTube channel on which we are streaming live. We also welcome any questions you may be having during the course of the discussion via the number that will be displayed on the screen. Dr. Kabweru,
yes, sir.
You were still enlightening us on the epidemiology.
Yeah, actually, initially also they used to think that this is a disease that is more common in black people. That is very true. In the blacks we have very high numbers, and this is a very common cancer. Among the top 5 cancers in the country, cancer of the esophagus is among those top 5. And actually, it can easily be diagnosed because the way it presents is very simple. But also we know that it is also very common in Black Americans and other Caucasians. It is also a cancer that you find in the whites, but not as much as you find it in the blacks. So most people are actually doing a lot of genetic studies around why this cancer of esophagus is very common in black people. So it is a common cancer in the blacks, which is actually not worrying, but it should make you wake up and realize that when you see it, it is not something that you didn't anticipate. It is a cancer that is anticipated in the blacks.
There is something important you have uttered, which actually the viewer out there and I myself would agree with, that it is easy to detect. And the reason I think perhaps is because it is messing with the system, which is very key to our survival as human beings. Going along that same line, what are the signs and symptoms of cancer of the esophagus?
Thank you very much, Andrew. Actually, the commonest symptom, in the other medical language, we call it dysphagia.
Dysphagia.
When people hear about dysphagia, they think, oh, what? Dysphagia is difficult or disturbed swallowing of food. What do I mean? Usually people may come and give you a story that actually in the beginning I was eating like a normal human being, eating my food, and it started going very well. However, as time went by, I could now take a number of soft feeds. And eventually as time proceeded, I could only now swallow drinks. And worse off, now I no longer swallow anything, including my saliva. I just spit it. So that is what we call a progressive dysphagia.
Dr. Kabweru.
Yes.
You have said that we are having dysphagia,
yes,
or what my grandfather in Budumbuli would understand as difficulty in swallowing
food.
But it is changing over time. That at first I am taking solid food, but with some difficulty.
Yes, but
then from solid food, it fails and I go to semi.
Those
solid
are
food.
soft foods now.
Soft foods.
So mashed food, so like for babies and whatsoever.
Yes.
Yes.
Now, from the baby diet or mashed foods,
yes, you go to drinks.
I go to drinks. And
yes,
literally when I take juice,
yes,
I'm having trouble.
And
now we reach the point of my own saliva where even swallowing my saliva is
a problem.
So
that is one of the symptoms, and it is a very common symptom. However, I want to state this, that actually other symptoms may come along because of the stage. Now, when that cancer is still contained, then you may not get other complications. But if it moves from that tube and it goes like in the chest, then someone may present with a cough. And that cough precedes either taking food or drinking something. And then when he takes something, he starts coughing profusely or non-stop, meaning that actually that cancer has moved from where it is to other parts like the lung, and there is that communication. So when you eat, also that food goes where?
The food is going to the
lung. So there is a communication, which we call a fistula. So if it reaches that side, then you just realize that it is no longer early stage, but it is already cancer that has moved in the late stages, stage 3 or stage 4. So it depends on the stage. But other B symptoms, what we call B symptoms, people get fevers, those are temperatures, high and low, and different times. They lose weight markedly. But now this person losing weight, the reasons are very obvious. They are losing weight, they are not feeding, but also they are losing weight because of the cancer itself, eating everything. So it is a combined thing. And then other complications also may step in because this person is not eating. So this patient actually gets very big challenge, but that is the commonest complication, that they are not feeding. Now, if they come or present with back pain, the back, most likely that cancer has moved into the bones of the vertebra here, or thoracic vertebra, and they may present with that upper backache, pain in the backache. And sometimes if they present with headache, then you may suspect that that cancer has also moved to the brain. So sometimes the signs and symptoms may be because the cancer is still within the system, or others may appear because the disease has also moved to other places.
Dr. Kabweru, I thank you so much, but I don't want to preempt this because I know there are other signs and symptoms you have in store. So I'm requesting that we have a short break, and we come back and continue with the discussion concerning the signs and symptoms of cancer of the esophagus.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk Show.
Welcome back from that short commercial break. This is the DOCtalk Show, produced by Quiz Mali Productions and proudly sponsored by the Ministry of Health and its partners. We have been talking about cancer of the esophagus, and our guest tonight in the house, Dr. Kabweru Wilberforce, was telling us about various things. He talked about dysphagia, or difficulty in swallowing, which can start from difficulty in taking solid foods, and you reach a point where you have difficulty swallowing your own saliva. And then he made a number of revelations, such as difficulty